Hello, I'm Jeanette Wider, and I am Managing Editor of Healthcare Innovation. Today, I'm here with Mo from ARMIS, and we're going to have a little chat. So, Mo, why don't we start by you introducing yourself, your title, your background, your role?
Yeah, for sure. So, hey, everybody, Mo here. Full name's Mohammed Okas. I'm the principal solutions architect for ARMIS. So, I actually specialize in the healthcare field. My background, I spent about 10 years working directly for a hospital, helping establish the information security program from scratch. So, it's very near and dear to my heart. I've lived through ransomware attacks, implementing new technologies, privacy breaches, helping establish governance programs. So, it's been a fun ride.
Okay, great. So, I'm just going to jump right into the questions I want to ask you. So, what's the difference between securing medical devices and your ARMIS strategy of securing the patient journey?
Yeah, for sure. So when you talk about securing medical devices, you're really looking at a single dimension, and I'll explain. So you can say, here's a CT scanner. I need to understand what vulnerabilities exist on it. I need to secure it. But that's only one part of the overarching patient care or patient journey, as we call it. So imagine if we take the life of, or if we take an example of a patient actually coming to receive care at a hospital. They're going to go and park their car. They're probably going to experience some type of gate, some type of payment system. They're going to come into the hospital, automatic doors. They're going to see digital signages to get them to the registration desk, registration kiosks, barcode and label printers to be able to track patients. And then they get to, let's just say, the operating room, and that's when they actually get connected to patient monitor. But then there's HVAC systems that are regulating the humidity levels and temperatures. So all of a sudden, when we're kind of following that model, I've just given examples of 10 different types of devices that are non-medical before we even got to a single medical device. And the interesting part is that these non-medical devices can actually impact and negatively impact patient care. So if that parking gate doesn't open, now there's a backlog. If that registration kiosk is down, now there's increased wait times. Same thing with digital signages. One of my favorite examples, though, is that HVAC system. So it's regulating those humidity levels in the operating rooms. But if that malfunctions, the humidity levels rise, you're looking at desterilization of the different equipment, and then ultimately surgery is getting canceled. So without even getting to the medical device part, we're looking at canceled surgeries and increased wait times before we even get to the medical devices. So really that securing the patient journey is a zoom out, is a step back, much more at a strategic level. Let's look at the entirety of the patient journey and secure all the different devices in a healthcare device ecosystem.
Interesting. I hate waiting. So I like that. I like that. Okay. So in your experience working for and with healthcare organizations, how have you seen the patient journey evolve over time?
Honestly, I must say it's phenomenal, the changes that patient care treatment plans and journeys have taken over time. I've started off with seeing nurses that are printing out charts and filling those out by hand, right? But then all of a sudden, now you start talking about cloud footprints. You have telemedicine. You have, when you're looking at technologies like 5G and enabling robotic and remote surgeries, these are all realities. If I look back 10 years ago, before cybersecurity and before technology was really a cornerstone of the focus of healthcare teams, it was the moment they hear cloud, it's an automatic no. Whether it's a massive $10 million project, it's an RFP, one sentence. Do you have a cloud backend? If it's a yes, you're automatically disqualified. And what we're seeing now, though, is because there was so much focus on innovation, because of, to your point, so much wait times, a lot of hospitals are going through massive evolutions in their projects. So you can see that when you have a large number of healthcare organizations, they're all upgrading their EMR systems. Before it was, if it's not broken, don't fix it. But now everybody in the industry is starting to realize there's better ways to do this. There are increasing requirements, there's increasing demands of our healthcare systems, so we need to get better. So we're seeing organizations upgrade their EMR to things like Epic. We're seeing them starting to embrace cloud applications. We're seeing them leveraging smart devices, right? Your physical security, your infusion pumps, diabetes departments going and purchasing smart and wireless glucometers. So really all this technology change is happening in such a short amount of time that there's such a massive change in the way healthcare delivery is now delivered.
Yeah. Yeah, that's really interesting. I mean, it really, when you think about it, it really wasn't that long ago that to go to, let's say, the doctor, you had to pick up the phone and call and like wait and then make and like have to go in for a physical appointment. And none of it was digital or virtual, nothing.
What's crazy to me is, and unfortunately, I lived through some ransomware attacks and things like that, but the abrupt change when hospitals go to downtime procedures, every piece of technology is out the window. They are literally going, they're charting by hand. And maybe that's why doctors' handwritings are so bad, because they are so used to using technology to type things out. They're not used to holding pens anymore. But it's literally, you go to paper-based policies and procedures. So everybody still needs to be familiar with doing everything by paper. And then just that stark contrast of a hospital going into downtime mode versus it's actually online, you really notice it then.
Right. That's a good theory too on the handwriting. That's pretty funny. So, what does this evolution mean for healthcare or hospital staff? So, from both IT, clinical, and support services departments, and what challenges are some of these organizations facing regarding that?
Yeah. So if we start from IT, right? Now they're going to be responsible for starting to support an increasing number of devices. And if you look at the help desk as an example, they might not be involved, and IT won't be involved when vendors bring in brand new shiny devices, when these kiosks are stood up and what have you. But the moment they're not working, clinical folks, support services, they're going to call IT to say, hey, my device is down. I need you guys to bring it back online. IT departments don't even know where to start. What device is this? So it's not your traditional laptops and desktops that they have a database of. They're starting to try and figure out on the phone, can you describe the device to me? What does it look like? Where is it located? Who owns it? All of this information for all these brand new devices simply are not accessible by the IT teams. The security side of the house, well, you have that challenge of understanding what's on your network. You're responsible for securing it, but there's so many gaps and holes, and so many people are bringing in all these different devices without you even assessing them, yet you're still responsible for it. So it's just an increasing amount of risk. It's just gradually and constantly increasing that security teams are always behind. They just simply can't keep up. With clinical teams, and this is interesting because clinical folks aren't used to change, right? Again, going back to the thing that hospitals haven't really changed in decades. They still run legacy technologies. They still run legacy types of devices. You don't replace an MRI machine every year, right? It's massive and it's
Yeah.
really expensive. So when you go to an ER nurse, probably the top three stressful environments in a hospital, the more you change the process, the more risk you're introducing into the environment. Because, and that's one of the things when I was in a healthcare environment and we went through massive projects, the amount of time that it took to plan the adoption, to plan the training, to plan all of that, simply so that every single nurse, neonatal ICU, ER, and all these critical departments, they have time to acclimate to changes. Because if they're unsure and there's a patient that's admitted and it's urgent and they're unsure how to operate all these different new technologies, that's a risk directly to the patients. So they unfortunately also have to put up with the change. And that's why ultimately advancing change and introducing and innovating new ways of patient care in hospitals, that's also another reason why I was very resistant to it, simply because we don't want to introduce any unnecessary change when it comes to treating our patients.
Okay. So let's shift gears a little bit. How have you seen this impact risk posture for healthcare environments?
Yeah, so when I look at healthcare environments, the risk is completely different what compared to a bank, compared to a government agency, right? Of course, you can argue that hospitals might have the highest level of risk simply based on, hey, these devices are directly touching somebody, they have the potential to harm them and what have you. Now, with any innovation comes risk. So what we're seeing in healthcare is all the different types of medical devices, as you were mentioning, you have your CT scanners and so on, but now it's amplifying because these, first of all, they're legacy approaches we were talking about. The medical devices, they're unpatched already, they're unagentable. The security teams, clinical teams, IT teams simply don't even know that they're on the network. But also, regardless of what happens, they must continue to operate. You can't simply kick off a device because you don't know what it is. You can't, even if a medical device gets impacted, gets compromised, maybe there's a malware attack on it, maybe it's just reaching out to malicious domains, that's also a risk that you have to put up with, and you can't necessarily just resort to kicking it offline immediately. So that's the first part, kind of that legacy piece. But now what you have is all these newer footprints of devices that are coming in, such as an ultrasound, let's take as an example. There are vendors now that they're not shipping your ultrasound units in the traditional model that you would think of. They're shipping you a Samsung Galaxy tablet, and you plug in the actual ultrasound component to do the scan into the tablet. So now you have what was previously a completely FDA regulated ultrasound device that's going through multiple different iterations of review, has extra scrutiny, has this ton of visibility from the clinical team. Now you have a tablet, right? And well, who's responsible for keeping that tablet up to date? Can I just enable auto updates on it? Will the latest version of Android run on it? No. Okay, well, I'm going to run Android from 10 years ago as opposed to Android from today. You also have small little Raspberry Pis, the credit card size machines that are connected to IP cameras in a hospital, and they're streaming live feeds from the neonatal ICU department. Now, if you go to a security team and you report to them, you have 15 or 20 of these unknown Raspberry Pis in your environment. Me being a security person, my instant thought is, if I don't know what it is, I want to kick it off the network. And now what we're seeing, and when I'm talking to hospital leadership and I'm having these types of discussions, is we really got to change our approach, because it's not only the risk that these devices are posing from a technical perspective, but now we need to start taking into account the clinical risk. So I have a Samsung Galaxy tablet, but it's directly touching a patient. It's so important to understand that context, because a Samsung Galaxy tablet that's being used, let's say as a patient feedback or customer survey, patient survey feedback mechanism versus one that's being used in an ultrasound, completely different context, completely different technologies. And that's the challenge with these non-standard medical devices, or as I like to call it, the evolution of these medical devices. The other piece is, and kind of this is actually a better point, is that we're starting to see the need to break that silo between biomed and security teams, not only to identify what medical devices are on your environment, but the biomed teams can come to the table and say, we have all these devices that have FDA recalls, or these are all devices that have imaging activities. The security teams can then take that information and, again, layer on the clinical context to really get a true understanding of the risk posture. Unfortunately, all this innovation, all these new vulnerabilities and the attacks are constantly increasing. We're seeing it consistently change, but we really need to evolve our way of risk assessment in order to keep up with the true understanding of what risk is posed in healthcare environments.
Right. That's really interesting. When I do research and interviews, I think it's so crazy to hear, such basic advice like you need to know what you have.
Mhm.
You'd think that everybody would know everything that they have, but they don't. So the next thing I think I want to talk about is the Patch Act. So
Mhm.
maybe we could start with you giving a little background for our audience who might not be familiar, and then maybe we could talk about how it relates and will impact the healthcare system.
Yeah, for sure. So the Patch Act essentially is an act that's looking at the security of medical devices now. So in a nutshell, there's a few different major points related to the act. The first one being that when manufacturers are trying to apply for approval from the FDA, there's a number of different cybersecurity requirements that they would need to adhere to. So it's a great step forward, because now we have, from a legislation perspective, incorporating cybersecurity into medical devices, much needed, well past overdue, as well as it's getting the manufacturers to be much more visible. Not only do they have to adhere to cybersecurity practices and requirements, but now they also have to establish things and produce things like software bill of materials that identify all the different software components that are on their medical devices, and as well as having plans to identify or monitor or patch cybersecurity vulnerabilities that can come up. So really, it's an act that's listening to the voice of the healthcare industry and security professionals in the industry that have been calling for this for a very, very long time. From a medical device manufacturer perspective, of course, there's a lot more requirements in order to be able to do that. From the cybersecurity practitioner side of the house, it's phenomenal. Now, of course, we got to see how this is going to be implemented and the levels of visibility that we'll be able to get. But if I'm a security practitioner at a hospital, this helps me from a procurement perspective, because my risk analysis, instead of it happening as the medical device is already in operations, when I really can't do anything at that point, we're getting teams and we're getting information about these medical devices from a cybersecurity perspective, from a risk perspective, before we even publish or before we even purchase it. So I can understand what security controls should be implemented from the get-go, from the moment this device comes on the network, because I already understand a whole bunch of different cybersecurity information, which previously wasn't available. Even for existing devices, if you were to email the vendors today and ask for a software bill of materials for a device that's already been in existence for 5 years, they still wouldn't have that information. So getting them, and again, to the point of visibility, hey, medical device manufacturers, now you got to build out visibility about your inventory as well. And the healthcare industries or the healthcare delivery organizations are not going to use your visibility to help secure their environment as well.
Right, right. So you don't want the innovation to stop innovating, which brings me,
100%.
yeah, which brings me to my next question. So we hear a lot about the need to innovate patient care. How do we prevent security from becoming a blocker or the no police for a lot of, so we can still evolve in the healthcare system and the patient journey?
Man, so I will say I am guilty about being the no police. I was probably captain of the no police, the lieutenant, sergeant, whatever you want to call it. Yeah, this is a really key point, because security has the challenge of being that fine line between, I need to secure my organization, but I can't be stopping it from achieving its goals. Prime example, I'm going to come in and I'm just going to cut off internet access for the entire hospital. That's secure. It's not practical. Right. So there's that balance that needs to be struck. Now, for the security team, I think one of the biggest challenges becomes their workload. And I'll explain. With all this innovation comes all the requirement for security teams to get engaged. Now, security teams, and this kind of goes back to, let's just say 2010, when there was a lot of different applications coming out, a lot of different cloud workloads and mobile devices and so on, but they never really had security in mind. It wasn't until there were breaches that happened. It wasn't until a lot of organizations came under the microscope, really had some pretty nasty articles written about them. And then the realization of folks that everything, even if you're talking about something like a gaming console, like your PlayStation, gets hacked. It wasn't until people started really looking at everything from that cybersecurity view and from that risk view that vendors, developers, and what have you, all these different organizations started really embedding security in. So I think legacy from, let's say, 2010 to 2015, there was a lot of no happening, and that no was happening for a good reason. But now what's happening is, because we're seeing healthcare go through a whole bunch of change, and especially now everything's decentralized, right? You got your telemedicine, you got everybody calling in, to your point, to the doctor, FaceTiming them, what have you. There's a lot of change that's happening, and security teams have the challenge of keeping up with it. Now, when myself and Oscar, who's our healthcare CTO, we were having this discussion, and we identified two primary things that hospitals are challenged with. One is, because of that increased demand for patient care, they really have two solutions or methods to try and adhere to that, or address it rather. The first one being, either I got to purchase more devices to keep up with the growing demand, or number two, I got to innovate and find a way to do things better. Either way, the security team has to be involved. And security team's review doesn't simply come in a day. It can take 1 week. It can go a lot of back and forth. I've done reviews where, if you look at an Epic EHR project, that takes a dedicated 1 or 2 FTEs for the entire 2 years of the project. So what we need to focus on for the security team to be able to help enable innovation is to get them automation, get them help in that regard. Because when you have a system that can automatically discover your assets, automatically detect changes in your environment, as your cloud assets spin up or spin down, as a new medical device has been added, as a new application that gets detected in your environment, When you have platforms that are automatically assessing all of this, the security teams no longer need to chase people, but now they've gone from a reactive state to a proactive state. And what will happen with automation is the things that get raised to their attention are what they actually need to focus on. You're not looking at 10,000 things and spending time resolving vulnerabilities on a low end system when you really need to be focusing on this area. So really, that's, from what I see, the key of how security teams go from being a no police to being actually enabling healthcare organizations. But we really need to help get the security teams out from behind the 8 ball and really equip them to be able to do rapid, quick risk assessments of their environment. Because at the end of the day, they're not trying to say no and stop innovation. They're just trying to make sure that the organization remains secure. We just got to equip them with faster and more prioritized ways of doing so.
Right, right. And nobody wants to be part of the no police, right? You just had to do it for your job.
Yep.
I understand. So the last thing I really want to talk about are what are about 2 or 3 key takeaways or recommendations you have for our audience, both technical and non-technical, to help secure healthcare systems, and how can staff be trained to take this on?
That's a great one, because I think when we talk about security, people are so focused on a hands-on keyboard, a technical vulnerability, a cyber attack, whereas really we like to evolve the conversation from security to risk, because security would be a subset of risk, but think about privacy. That's another layer of risk, right? Think about the clinical context we've been talking about, patient safety, that's risk. So really, I like to talk about it from a risk perspective. So I'll start with this. Let's start with the risk management and security teams. So we need to evolve our risk management models. We cannot expect to take legacy ways of doing things and try and fit a round peg into a square hole. So the concept of visibility, it's no longer limited to the enterprise devices. It shouldn't be contained to simply medical devices. We've been talking about securing the patient journey this whole time. So it really needs to be a strategic level of visibility that encompasses everything. And that's where it's really good to get the risk management teams involved, because they can look at it from the entirety of a business perspective, not simply the security team trying to do a vulnerability management program. Now, the second angle is to understand the clinical context, because doing that true risk analysis is how you prioritize. And when you prioritize, that's when you start seeing results. Because without prioritization, again, you'll have 1,000 low vulnerabilities on this one device that you're focused on, but all the criticals that really help move the needle, that's all being missed. Now, for non-technical, let's say clinical units, decision support, engineers, and so on, engage your security team. I cannot express this enough, because if you're thinking about changes, if you're thinking about projects, buying new tools, even something really cool you've seen in the news, I've had folks that emailed me saying, hey, I saw this amazing article. What are your thoughts on it? Do you think we can buy this? What have you? This accomplishes 2 things. One is that it gets the clinical folks, or it gets the non-IT folks thinking about security. It starts becoming more part of their DNA. The other piece is security teams love to get engaged, and it helps break the silos. So now you're fostering more of an environment of cooperation, whereas previously it's the siloed approach of us versus them. And then when you have this, you start embedding that security and privacy by design thinking across the organization, where, hey, we're thinking about buying something. Well, what does the security team have to say about this? Right? We want to get some of their feedback. And then this proliferates throughout all the different initiatives that security has with the business. Password change, phishing emails. If you're the biggest thing that I've noticed that really helps security teams is opening up that line of communication between the different business units. When I'm talking to clinical folks, it's ask those questions. And I really like to emphasize that, especially to them, security is not an IT function only. We need the clinical teams to let security teams know if they notice anything. We're only as good as the visibility that clinical teams can help get to us. So, and the prime example I use from my experience is there was an Amazon Echo that was deployed in a semi-private room. And that time it was a privacy risk, because somebody can be recording the doctor, and this wouldn't be maliciously. The person actually unfortunately lost the use of their arms, but if the doctor next door is talking about treatment plans and other information that's being recorded by Alexa and potentially going out to the cloud that hospitals hated, that's a privacy risk. It wasn't until a nurse saw the ring of light on top of the Alexa that she picked up the phone and decided to call us. It wasn't until that person called us that we even found out about it. So really, I think it's not stated enough on how valuable clinical folks are to the overarching success of a security program in a hospital. And you can engage them in different ways, right? With if there's kind of like a little mini roadshow, hey, once a month, security team gets in front of the clinical teams or what have you. And this is going to be the last, how I wrap up this recommendation is for the executive team. So for the executive teams, security is, of course, ridiculously important. We got board members asking the CIOs, the CISOs, that loaded question, are we secure when something hits the news? Now, for that executive team, for the entire hospital, it really takes a tone at the top and support from above to really move that needle. Because I mentioned security is an organizational focus. Now, just like you need executive sponsorship on your brand new, shiny, innovative patient care upgrade project, you need that for security as well. And security is everyone's responsibility. And I like to stress that it's not a checkbox, it's a journey. Okay. And that journey, and in the long run, and at the end of the day, it enables your business. All right. So it enables your business by preventing downtimes. It helps you innovate your patient care. It helps you reduce your cost. It helps increase your revenue. It helps keep the patients safe and secure. At the end of the day, if you're a clinical executive leader, you care about that stuff. And security helps ensure that you have that. So really, that would be my advice to them, is across all levels of the business, have your direct reports, have your different business units. Again, engage a security team, foster that relationship, foster that conversation, and really help secure the patient journey.
What an insightful answer to wrap this up. Like, very good advice for our audience. So, Mo, unfortunately, we're out of time, but I want to thank you for spending the time to talk with me today. This was all very interesting.
I appreciate it. Thank you so much for taking the time. And I got a little bit geeked out there. You can tell the passion runs deep, but I do appreciate everybody's time. And thanks for tuning in.
Great.